Hey y'all, if you've ever thought, why does this GLP-1 medication feel so different? You're not alone. Most of us are used to medications like painkillers and antibiotics and other things that you take for a very specific purpose. They do their job and then they're gone. But GLP-1s are different. They're not just treating one symptom. Think about taking a Tylenol for a headache. You're taking a simple drug to relieve a single symptom, and when the symptom's gone, the drug's gone. GLP-1 therapy is different. The goal isn't to influence one symptom, it's to change the regulatory processes that regulate hunger, weight, metabolism, and energy balance. Once you understand that, it makes sense why it takes a while doses need adjusting over time, why side effects may come and go, and why it's so highly individualized. Everybody's journey is different. And once you understand that, a lot of things suddenly make sense. Why do I have to change my dose over time? Why are my side effects different from everybody else? Understanding that this is an adaptive long-term process is actually the secret to a successful GLP-1 journey. Hey y'all, I'm Eric, the Chief Science Officer with Shotsy, and in this video we're going to talk about why GLP-1s feel different. And this is the first video in a new series of GLP-1s, understanding why there's so much hope, hate, and hype around these drugs, and hopefully in a way that makes your GLP-1 journey far easier and far more successful. So subscribe and follow along. Okay, so why is it different? Unlike the Tylenol, GLP-1 mimics a hormone that your drug already makes. It's a substance that's already in your body and already has a job that it's doing, and you're changing the way it's doing that job. Every time you eat, your intestines release GLP-1. It controls how fast your stomach empties, how full you feel, and how satisfied you even feel after a meal. Very normal biological processes that are now being changed by this drug that you're taking. GLP-1s don't introduce a new biological signal to your body. They change a biological signal that's already there. And that's actually very, very different than most drugs that you take. And that's why the experience of GLP-1s can feel so different from all the other drugs you've ever taken. So why does finding the right dose takes time? Well, because you're changing or influencing a natural body process, dosing needs to start gradually. You're not just avoiding side effects. You're trying to sense how your body is going to react to you changing a regulatory process that's already in place. And everybody's different. You have different starting body weights, different genetics, different hormone sensitivity, different activity levels. So everybody's a little different, and everybody's hormone sensitivity is a little different. That's why tracking dose over time and dosing to affect your hunger, your weight, your energy balance, your side effects is such an adaptive process, and it just takes time. If you're dosing once a week, it's going to take weeks and weeks to figure out exactly how your body's adjusting, but that's a good thing. You don't want the worst side effects or the worst disruption of your natural body processes. So people often ask, why do the GLP side effects affect me so many places? You know, usually if I have a drug, maybe I have one side effect and it's isolated. Why are GLP-1 so different? They're different because GLP-1 receptors are everywhere. They're in your digestive tract, they're in your brain. You're going to experience things differently. People ask, why do I have constipation? Why do I have nausea? Why do I feel so full so quickly? It's because your body is sensing this hormone all over the place, and it's trying to interpret those signals over time. So again, slow regulation is very important. So when you adjust this signaling system, you shouldn't affect just one effect. You actually understand that you're going to hit one switch and different things are going to change. It's why this is a slow adaptive process. So the truth is, as you change dose or as you adapt to a different GLP-1 or when you start it for the first time, you actually should affect multiple effects. This is the way these drugs work. You just want to adapt carefully to that over time and understand that this is a big change for your body. Messing with the regulatory systems for positive reasons is still a large change. This also explains why stopping GLP-1 therapy can be difficult. Your body has become accustomed to this new reality, and stopping the drug suddenly is going to be a drastic change to that reality, and there's going to be a regulatory response, often an over-response. And so stopping is something that has to be very carefully thought about and managed. Your appetite, you're feeling full, your food cravings, all of those have to come back into balance on their own in the absence of introducing the artificial GLP-1 to your body. It's one of the main reasons these medicines are far better viewed as a long-term treatment plan and lifestyle change than a quick fix of taking a few shots, getting a little result and going away. It's probably the worst thing you can do. It's not that you necessarily become dependent on these drugs. That's really not how it works. But what you do is when you started taking the drug, your body adapted. And when you stop taking your drug, your body is going to have to adapt again. If there's one thing I'd like you to take from this video, it's that GLP-1s aren't just another prescription. You're not just taking a small bit of aspirin to cure a headache. You're entering a therapeutic regimen that's going to alter the hormonal balance of your body temporarily while your body weight adjusts to the way you want it to. And at cessation, you're going to have to re-alter that hormonal balance back. This is why dose adjustments matter. This is why side effects are almost inevitable, but why they change over time. And that's why patience and adaptation are probably the most important parts of GLP-1 therapy. The more you understand the biology, the less mysterious this drug is. Thanks for watching. I hope this helps you on your GLP-1 journey. And to track that journey, please check out the Shotsy app and please subscribe for the remaining in this series where we're going to go through a lot of the other unexpected myths between the hype, hope, and hate around GLP-1 medications. Thanks all. Cheers.